It's a chronic illness, so it's a chronic care model where providers are following patients over time. So there's a lot of opportunities for interactions with patients. Typically, the standard model is you see patients at scheduled office visits, then you see them as needed for quick, sick, or urgent care visits. In between, events can happen, patients can develop complications of therapy, they can develop flares of disease, and there's often a need for telephone encounters between either the patient and provider or the patient and a physician extender like a nurse practitioner, a PA or nurse, sometimes even office staff. So IBD, and in addition, IBD is a exacerbating and remitting disease where patients will have flares of symptoms and then periods of remission, and the idea behind medical therapy is to smooth those peaks and valleys out. So it's sort of an ideal situation of a chronic disease model with an intermittent disease course. One issue is non-adherence to therapy, and it's not even just medical therapy, but sort of non-adherence to the treatment plan, and it's a common problem affecting 40 to 60% of patients. So we have good drug therapies, but getting patients on them and getting them stay on them can be a challenge. For example, patients will feel well when they're in remission, and having to take your medicines on a daily basis, or if you're doing injectable or an infusion drugs, getting them every week, every other week, or every 8 weeks can be a challenge. So that's one. Access to care can be difficult. Maryland is really a 5-state referral center, so some of our patients can come 2 to 3 hours away, so getting access into us can be a challenge. Insurance barriers can be an issue, high copays, side effects of medical therapy. Patients with GI illnesses, particularly IBD, seem to be very sensitive to medications and have higher rates of adverse drug reactions. There's challenges with our female patients. Most of them are of childbearing age, so we're using medications where there's significant concerns about adverse events in mom or the baby. Fortunately, the safety profile of most of our drugs is quite good. And then the medicines we have, the perhaps more effective medicines, the immune suppressants and the biologic drugs, their safety profile is very good, but there are uncommon to rare side effects which patients are very concerned about. So trying to explain the benefits to risks of therapy and doing that in the setting of a 15-minute, 20-minute office visit can be a challenge.